Welcome to Beautiful, Confident, and Safe, a podcast by Lewisburg Plastic Surgery featuring Dr. Normington. Hi, I'm Jordan Thomas. In each episode of this show, Dr. Normington and I will sit down for an unscripted conversation about a variety of plastic surgery topics. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision and allow you to feel beautiful, confident, and safe. Let's get started. Hi, Dr. Normington. How are you today?
Great, Jordan. How are you?
Good. So some of our surgery patients might not know it, but we actually have a skincare center in our office where our patients will see Misty or Trisha for different skincare procedures or products. Can you explain to me the importance of using these products and keeping up with your skin?
Sure. So, yes, we have a skincare center, and it's run by, we have two nurses, and all they do all day long is take care of people's skin. Mm-hmm. So they're focused on skin health. Some general recommendations about skin health. Surgery structurally changes the skin, but it doesn't really change the skin itself. So the analogy I like to use when you think about having surgery, it's kind of like that old chair. You take that chair, you restuff the cushions, you fix the broken leg, but it's still the same old fabric. Mm-hmm. So skincare can rejuvenate that fabric and get that fabric looking better, looking more youthful. Mm-hmm. So surgery, might be able to take care of loose skin or move skin around and that sort of thing, but it can't change the skin itself. So that's why skincare is so important, and that's why we try to work hand in hand with our skincare nurses to really provide the patient the best possible result. Mm-hmm. And a lot of that is doing some healthy things to your skin. So, some general recommendations about, taking care of your skin and things you can do for your skin. First, don't smoke. Yeah. Smoking is, terrible for your skin. People, think about smoking and its effect on the lungs but it's terrible for your skin too. If you take two twins, one smokes, one doesn't, the twin who doesn't smoke, their skin will look 10, 20 years younger. So smoking really will degenerate your skin. It's been shown that nicotine disrupts the elastin in our skin. So elastin makes your skin youthful and makes it snap back, and studies have shown that the nicotine actually is destroying that. So one easy thing again, don't smoke and stay away from people who smoke, because it's bad for your skin. The other thing is the sun. The sun is terrible for your skin. So we all like to be in the sun, and it's great to have a nice suntan, but it's not very good for your skin. So one of the first thing our skincare nurses will do is get our patients involved with sun protection. So most of the products that we recommend do have built-in sun protection, but we get people using sun protections, sun blocks every day. So quite literally getting up in the morning and putting some products in your skin that will contain sunblocks, because you're getting sun in the car, walking from work to your car, you're getting some sun. So sun protection is really important all day long, and just not when you're at the beach or the pool or the golf course. So those two things are kind of basic things that people can do to improve their skin. And then, as far as, what should we do to improve your skin? We recommend getting a patient involved with a skincare program. So rather than, give you a prescription and send you down to the pharmacy to get a cream to use, we try to come up with a global program for skincare for the patient. Mm-hmm. So the same way you get up every morning, you brush your teeth, you comb your hair, we try to get our patients to spend a minute or two on their skin. And it's not applying makeup, it's applying products that are going to make your skin look better over time. And the products generally, in some way, will exfoliate the skin. So the exfoliation process over time improves how our skin looks. So problems like fine wrinkles or even things like acne scars, things like that, if that skin is exfoliated over time, the fine lines will improve, the tone of the skin will improve, problems like acne will improve. So many of the products that we use are exfoliating the skin. So some things you can buy over the counter will exfoliate the skin. If you look at some of the products you might buy, you might recognize ingredients like glycolic acid. It's real common in skincare products. Those acids are exfoliating the skin. We try to get our patients involved with another acid called retinoic acid or retin A. So retin A is a great exfoliator of the skin. It's very powerful, and patients who use retin A every day over time, it really will rejuvenate the skin. The problem with retin A, it's an acid. It's pretty strong, so we usually have to get the patient involved with moisturizers and other things to make this acid more better tolerated. I hate giving patients a prescription for retin A because it usually isn't tolerated very well. They use it for a couple of weeks, hate it because it's burning their skin, and they'll stop using it. So a better approach is having them sit down with our skincare nurses. They will get the patient involved with a regimen using retin A, but we'll also then use products like moisturizers, other things to make that retin A better tolerated so that they'll be able to use it. That's why I think the benefit of having a integrated skincare program is so terrific, because we have these experts, and honestly, the skincare nurses know 10 times more about this than I do. So patients ask me what to use, and I defer them to our skincare nurses because they're so much more knowledgeable, because they study this every day. They're using the products every day, and the products are constantly improving and changing. So they're up on it, and they'll get that patient involved with a program they're going to use and use over time, because it does take weeks to months for these products to work. But if using them over time, it can make a big difference. Yeah. So that's why I think we have an exciting skincare program. We do integrate. Our skincare program isn't just creams and products. We do integrate it with peels and laser treatments and some other sophisticated things that can really change the skin and improve the skin.
Yeah, absolutely.
Yeah.
I mean, I can myself even speak to our skincare products. I started working here a little over a year ago and started using products that Trisha and Misty had recommended to me, and the difference I've seen in just a year is crazy.
Oh, great.
So, yeah.
What product are you using?
We sell the products from Environ.
Yeah.
I use the ABST4, which is a moisturizer, but it does have that retin A in it, and other skin good products or good ingredients that help with wrinkles and discoloration. And when I was younger in high school, I struggled with acne and different pore issues and stuff, and nothing that I got over the counter from my dermatologist that I was seeing then really helped me. It really kind of made my skin flare up more. Yeah. So it's crazy that these products that my skincare nurse told me to use has made a world of difference.
Yeah. So we use a lot of Environ products, and we like them. They're natural products, so they're not a lot of chemicals, but many of them do integrate with retin A, and our patients have been real happy with them.
Yeah, I definitely am.
Well, that's great.
Yeah. Well, thank you for the info on it.
Sure. Thank you.
That's all for today.
Okay, thanks, Jordan.
That's a wrap on this episode of the Beautiful, Confident, and Safe podcast, brought to you by Lewisburg Plastic Surgery and Dr. Normington. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery, please visit us online at lewisburgplastic.com or find us on Facebook at Lewisburg Plastic Surgery and Dermatology, or on Instagram at Lewisburg Plastic. We'll see you next time.